and welcome to Physiofusion for hip and groin pain. Today I'm going to show you a series of exercises to improve your strength, mobility, flexibility and stability in your hip joint, and to relieve your pain so that you can get back to doing the things that you love in no time. The hip joint is a ball and socket joint where the femur or thigh bone fits into the socket of the pelvis, which is called the acetabulum. As we get older, the space between these two bones becomes narrowed and extra bony growths called osteophytes form. This is what we call arthritis. Your hip joint becomes a little bit like a bike with a rusty chain, where the surfaces of the bones don't move smoothly over each other. Good news is that just like a bike with a rusty chain, if you keep your hip joint well oiled, it'll work for years without giving you too many problems. Also, the stronger you can make the muscles around your hip joint, the better it will function. This is particularly important if you've had a hip replacement, where the muscles around the hip joint have often been stretched or even cut. If you don't strengthen the muscles properly, your new hip joint won't work as effectively as it should, or may even fail down the track. A lot of my patients with hip pain also have pain in their knees or lower backs. So if you are getting problems with your lower back or knees, it's a good idea to check out my Physiofusion for lower back pain and Physiofusion for knee pain DVDs. Now we're going to do an exercise to improve the mobility in your hip joint. So pull one leg up and gently roll your leg around in a circle, starting from the inside and working out. Remember that the hip joint is like a ball and socket joint. So what we're trying to do is roll the ball around the socket to help smooth the edges of the joint. If it's painful, just try a smaller movement and don't pull the knee in so far. So place the TheraBand around your foot, bend the knee, straighten the knee and pull the leg all the way up, trying to keep your bottom down on the ground. Hold for 10 seconds. Then bend the knee again, straighten the knee and pull the leg up. Bend, straighten and pull the leg up. With the towel around your ankle, pull the thigh back so that you can feel a stretch at the front of your leg. Keep the bottom leg bent up because that stops you arching your back. Hold for about 10 seconds. And relax. Pulling the thigh back again. Keeping your ribs and tummy in, making sure that you're not arching your lower back. Bend your knees up and keep your heels in line with your bottom. Then squeeze your bottom cheeks together and lifting your knee up. Hold for 10 seconds and lower it down gently. Squeezing your bottom cheeks together, lifting your knee up, holding and lowering it down. It's important to make sure that you don't roll your hip back when you do this, so keep your hip forward, squeezing your bottom cheeks. So it's not a very big movement, you don't want the knee to come too far past the hip. We can also progress this by lifting the whole leg up. Now that we're in this position, we need to make sure that our heels are in line with the bony bits of our bottom and that our knees are in line with our second and third toes. Then we want to lift the bottom up, keeping the ribs and tummy in, and then lowering down joint by joint through your back. Lifting the bottom up, keeping your ribs and tummy in, and then lowering down joint by joint. Squeezing your bottom cheeks together as you lift the bottom up to help keep your pelvis stable. So now you need to grab your massage ball and stand up. Place the ball behind your back, just underneath your rib cage, and gently roll the ball up and down, bending your knees just a little bit, moving from side to side and up and down. If you find a sore bit, just rest on it for a few seconds. Just try to make the muscles relax. It's important to make sure that you're putting the ball on the muscles, not on the bones in the spine. So we're trying to relax the muscles either side of the spine with this. When you want to move the ball down a bit lower, just move the ball rather than actually bending your knees too far, because it's a little bit hard to relax when you're bending your knees. Move the ball a bit lower now into your bottom, gently moving from side to side. See if you can find another sore bit. So taking the ball now and putting it onto your side, standing side onto the wall, and rolling the ball up and down and forwards and backwards. Moving the ball down a little bit lower now.